Hi, welcome once again to Senior Focus. I'm your host, Bill Adams. Senior Focus is a show designed for people over the age of about 50 or so, for older adults, but of course if you're younger than that, you can stay tuned and maybe you'll get some information that can help somebody in your family or a neighbor. We come to you a couple times each month through Armstrong's Channel 20 and 100, and thanks to Greg Roten, who is the producer of the show, and he makes sure that it gets on the air. We also like to thank Keith Kaiser. He's the director here at the Davis Center, Fellows Riverside Gardens, and he's nice enough to let us use the beautiful Davis Visitor Center to film the show. And we encourage you to come out, all year round, but the gardens are beautiful, especially in the warm weather. So make sure you come out to Mill Creek Park. Today we're going to be talking with Easter seals, and they're of Mahoning, Trumbull, and Columbiana counties. And I'll introduce the folks that are here. Why don't we start on the far left, as you see. Jody Harmon is with us, and she does marketing.
I'm the Director of Marketing and Public Relations for Easter Seals in Youngstown Hearing and Speech.
And Shirley Miller-Liley?
Yeah, perfect.
I got it right this time.
You did.
Well, Shirley's been on the show before, but you want to describe what you do?
Okay, I'm the financial manager. I oversee the billing for Easter Seals in Youngstown Hearing and Speech. I've been with the programs for the senior programs for the Title III for meals and transportation for a long time. And I enjoy everything I do with the programs. Mm-hmm.
And we have also Tim Nelson. Tim is the new director.
Yes, I'm the CEO and president of the organization, and happy to be here, and thank you for having us.
Yeah. Well, Tim, why don't we start with you? How long have you been with Easter Seals?
You know, I've only been with Easter Seals about 13 months or so. So
okay.
I'm kind of the new guy on the block still, learning a lot of things, but again, excited to be with the agency.
Right. And what we're going to do today is talk about a whole range of senior services, designed for people in Mahoning, Trumbull and Columbiana counties, all three of them. You can, at the top, why don't we give out some contact information, but why don't we give out the phone number and the website, and Jody, you want to talk about that?
Sure, you can always reach us by 330-743-1168, or you can visit our website, which has all of our programs and services, which is www.mtc.easterseals.com.
And it really is a good website. I mean, I was very impressed. If you click on the tab for senior services, at least about 10, 12 things pop up. And I thought we'd talk about those. And maybe we just go in alphabetical order because that's easy for me, I don't have to remember where. But, and in fact, one of the first thing that is listed is the Adult Day Center. And I know that's been around for years, and again, feel free, anybody that wants to jump in and talk about that.
Sure. We established that in 1987, and we are now currently at the 721 building on 224, right there next to TJ Maxx. And we have a wonderful program there for seniors and also adults with any kind of disability or special need that might need our services.
Shirley, have you been there? I mean, you've seen it?
Yeah. Many times. I'm actually my office is in the Youngstown office, but then I have the opportunity to go up there for meetings or whatever, and it's so rewarding to be up there and see the services that the adult daycare does provide. And personally, I'm actually looking for services for a loved one of my own, and I am ecstatic to know that our adult daycare is available, for this individual. And I'm just, there would be no other place I would send them. They do karaoke, they have games, we have an activities director. They're always, involved. They do bingo every day. They have meals. I'm going up there, I can see that they're all so happy to be there, and it's very rewarding to know that.
Yes. And she really does kind of, Lisa, who is our director there, activities director, she really tailors that to the individuals, the activities, to all the needs of the clients, and works with the family. So there's really a personal touch on our program.
Yeah, we have several veterans that attend, and we do get funding from the Veterans Affairs. And because of that, I know that she has geared a lot of that towards, their history and, their memories. So like on Veterans Day, they had a huge celebration. And it's wonderful to see that it really brings them back and happy. They're very happy to attend our center.
Sure, and Tim, maybe we could talk about what the role is of an adult day center. We talk about maybe the continuum of care from people who are independent, living at home on one end, to maybe somebody who's in a nursing home and needs, full-time 24-hour. But the adult day center fills a real need in between.
Sure, it's a lot of the clients are people who are still living either independently at home but can't be alone all the entire day, or again, they may be living with a loved one, with a family member, something like that, and again, they're not home during the day and they need someone to take care of the adult, or even potentially just to give them activities during the day, so they're not sitting at home alone watching the television, listening to the radio, sleeping all day long.
Sure.
And one of the things that I think is very neat about our program is it has a strong medical-based component to it.
Okay.
We have a registered nurse there, we have an LPN there, they're able to, if the client is on medications, they're able to get their medications delivered to them and everything. So it's not just come and fellowship and have a good time. That's a key part of it, because that's what keeps their minds sharp and active and everything.
Sure.
But there's also the medical-based component that we can take care of some of their medical needs there also.
And we can also offer therapy
Absolutely.
to those clients. If they need occupational therapy, speech therapy, or physical therapy, we could do that right on site.
Oh, that's great, yeah. Well, that brings up a question, and I don't know if anyone would have the answer, or we could, maybe refer them to someone, but if someone's interested in attending or starting up there, what, did they have to go through a doctor to get some kind of, maybe a doctor's order, or is it just maybe making a call and making an appointment? How do you get started to use the adult day?
Just a phone call to the Adult Day Center.
Okay.
It doesn't require any type of referral from a physician or anything.
Okay.
They can come down. They can walk through the facility. They can spend a day there. They can see if it fits for them, and then we'll work out getting them in if that's what they want to do.
And then the RN clinical supervisor, she does an assessment, with the family, and to determine some of their needs, and basically that's it. So that they are aware of everything that, anything that the special needs of the actual client.
Sure.
Yeah.
About how many people would you say are there? Do we have an idea of how many are there in a particular day?
Currently, some don't come every day.
Right.
Some come, on opposite days, but we usually on a daily basis between 20 and 25.
Yeah, I think
per day.
we're averaging probably a little over 25. I think when I went through the numbers last year, there were there were 57 people that had attended, at least more than once.
Sure.
Regular people, as Jody said. Some are only there Monday, Wednesday, Friday, or something like that. But on average, I think we're probably between 28, 25, 28, 30 or so in the program.
And they don't have to attend all day either. They can
Right.
come for half a day,
Oh, good.
whatever their
Okay.
needs are, like a morning or afternoon.
How about financially? How is this paid for? Is this private pay, or do insurances sometimes cover this, or Medicare or something like that, Medicaid?
Well, we do have the private pay, of course, and also the Veterans Association,
Okay, yeah,
the
you
affairs. There's Passport, there's Title III monies from Trumbull County. So a resident in Trumbull County can attend our facility in the Mahoning County.
Oh, good,
And
okay.
we will be able to transport them too, if that is, something of their need too.
Okay,
We also have the Trumbull County Senior Levy Funds. So again, if a resident of Trumbull County needs the adult day, they can,
Apply, yeah.
contact us. And then based on the funding, they do an assessment, and then the individual can be brought into the Mahoning County Center. And we will transport for those too.
Yeah.
It's all part of the package.
so as you're talking about, again, and this is sort of go into a lot of the other services. So you go to the adult day center, you might be brought by the van through your transportation. You might have a meal, which is also part of what you do, and the therapy.
Oh, yeah.
So,
And entertainment.
and entertainment, there you
Yes.
go.
Yeah, Bill, if I could, just one other thing I'd like to say about you talk about, how it's funded and everything. We were very fortunate a couple months ago to receive a very nice bequest from someone that had passed away that had been associated with the program in the past.
Oh.
And part of what we're doing with that gift is creating almost a scholarship fund for a client that, as Shirley said, there's many, many insurance resources and grants that we will try and use to apply to a patient, but let's just say that there's none of those. We
Right.
want to use a portion of this bequest that we were given to set up a scholarship fund to help pay a portion of what that we might call a private pay patient would have to pay.
Oh, I see.
So we're trying to set that up so, again, to make it easier for those clients that need the service to access it. Because as we're talking, it's a tremendous service, not just for the client, but in many cases the family or the caregiver, any of those type of things. So we're very blessed to have received that gift, and we want to turn that around to help more people come into the program.
Well, and that, again, that brings up a good point about the value of this. Again, the idea is, if we could delay people going into assisted living or nursing home care, it saves a great deal of money both for the individual and their family, but also through Medicaid for the state of Ohio, for taxpayers. So adult day services, adult day centers like this are very valuable. And, well, at this point, and maybe we could mention this again later at the show, but you brought up a bequest. Would people be able to call, or who would they talk to if they're interested in making some kind of donation through Easter Seals?
They could probably call myself, or they could call Miss Jody. Either one of us would be more than happy to talk to them.
Absolutely.
Right.
Absolutely. We would love to have somebody come down and give them a tour, and they could see what we're actually doing and really the impact of their donation
Right.
is making a difference in the lives of others.
Well, and again, because you've been doing this, Easter Seals has been around for about 100 years, is that right? Something like that, yeah?
I think the history kind of goes back to Edgar Allan, where, his son was tragically killed in an automobile accident in 1907, and then it kind of spiraled from there. He found that there wasn't much medical care, so in Elyria, Ohio, he decided to open up a medical hospital to help, but then he found that there were children that had disabilities and special needs couldn't get the services that they need and were kind of hidden, actually,
Right.
so that's where it all came full circle. And then we were, right, he
Yeah,
was
you're
part of
working with-
Rotary.
Yeah, you're working with, children, adults,
Right.
a whole range
The
of
whole
people.
gamut,
And
yes.
with people with various disabilities.
Sure, from birth to, our oldest client was 103.
Is that right, 103?
Yes, she stayed in the home. We were able to provide transportation for her. We were able to keep her in the home through our home health care, private duty services, and then we brought her to the adult day center. And of course, she could have ran the adult day center, so she was quite lovely and really enjoyed her stay there.
But I think that's an important part, Bill, because, as I said, I've been with the organization for 13 months, but truly one of the things that attracted me to this organization was, as I like to say, the depth and breadth of the services that we offer.
Right.
We offer so many services, and I think initially people might think of Easter Seals in this area as primarily the rehab services and the pediatric services, which are a key part. But this is why I appreciate so much being with you here today, because the senior focus, that's every bit as big a focus for us as it is, and it may not be as well known.
Right.
All the different services that we offer. So again, thank you for having us here today.
Well, we covered the adult day center, and we'll try to touch on each one of these, but just quickly, maybe the aquatic. Do you have a pool?
We do. We have
Heated pool, isn't
a
it?
heated pool. It's at our Edwards location.
Okay.
And it is a heated pool, and we offer therapy in the pool, through physical therapy, and we also have fibromyalgia, arthritis, and it's just a hidden treasure.
Well, that would be great. Again, a lot of seniors are going to be able to benefit from
Sure.
something like that.
Sure.
So they would contact the
They would contact the
Edwards?
center,
Okay.
the main number, and that also requires a referral for therapy to get
Okay.
that. But as far as our maintenance programs and that, it's not something that's required.
Okay. How about the audiology? This is something that I was very happy to learn about. You work with, again, all ages, but
All
seniors
ages.
with
Absolutely.
and could you describe the partnership you have there with, is it the speech? Hearing and speech?
Yes, yeah, Youngstown Hearing and Speech is part of the Easter Seals family.
Okay.
And the audiology services, we're providing hearing tests, we're providing evaluation of hearing problems for adults and children. We also offer the latest in the digital hearing aids, the repairs, the fittings, the assisted listening devices, excuse me, all of those things, a complete audiology and hearing service.
Okay.
And again, we accept all kinds of insurances with that. We do have some grant funds through United Way and some other entities that, again, we can help the clients who may not have the insurance, may not have the means, again, through very generous gifts from United Way and some other places for seniors, we're able to provide some funding assistance for those.
Because many insurances do not cover for the hearing aids.
Okay.
So because we do have some grant funding, that it's another added service that we can actually help and assist individuals, with the need for the hearing aids. They can contact us and they do a financial paperwork, and then we determine, how much we can, put towards, the cost of the hearing aid.
I think, Bill, what really sets us apart as well is that we're there to fit the hearing aid to the individual. We're not there to work with a big company or anything. We're there to make sure that they get the appropriate hearing aid that works, that fits, and is comfortable for them.
And where would people contact to learn more about that?
The same number, 330-7. We just have one hotline number.
Well, we'll keep repeating it.
743-1168.
Okay, well, that's good to know, because I know, just working with people in the community, my own family, and also, through senior centers and things like that, there's a lot of need for that in our community, a lot of need for hearing services.
Yeah, and I actually wrote a grant through the United Way a few years ago, and I did a lot of research myself, and I found, and it was determined that so many people do not get the hearing aids because they cannot afford them.
Right.
And that's the sad thing, and then they're missing out on a lot of things. It really, becomes a handicap to them. So we are always trying to, put the message out there that we have a lot of funds available that we can help individuals, be fitted for the right hearing aids.
Well, thank you, and again, we hope, if you know of someone, you'll get in touch with Easter Seals. And the next was the congregate meals. If, again, whoever wants to take the ball on this one, or you all want to join in, but the congregate meal sites are designed for a group, people in a group around the county getting a lunch every day, is that right?
Yes.
Okay.
And also there's a social, that they could go there and socialize. They have games there. It's probably open between 3 and 4 hours every day, Monday through Friday. We have 11 centers, I believe, now. I believe there's 4 in Columbiana County and 7 in Mahoning County.
Okay.
So they could contact the 330-743-1168 if anybody would like to contact the office and to get the addresses where they're located. But they are meals that are brought in through our company, through AVI. AVI is the meal provider.
Okay.
And we have a site supervisor there, and it's through our Title III. We receive Title III funds through Area Agency on Aging. We write a grant.
Okay.
And we've actually had that grant since 1994.
Yeah, I was just going to read off, if I could, the list in Mahoning County, and correct me if maybe it's been updated, but it says Bethel Lutheran Church, Gutnick Towers, Lowellville Apartments,
Yes.
the McGuffey Center, Norton Manor, Phoenix House, and Struthers Manor. And of course, there are other locations in other counties.
Yes.
So that, again, that's open to anyone, 60?
Yes.
60 and over?
60 and over.
Okay.
And that's not in regards to the financial,
Right.
situation at all. If they would like to attend, they have to contact the office to see if there's,
Spots available, yeah.
availability. But they can go, they don't have to go Monday through Friday, they can go when they can. They come in and they sit down and make friends, play cards, bingo again.
And again, it's a hot meal. It has all there are strict nutritional requirements that it needs to meet for that senior. And again, there's, other than being a senior age 60 and over, correct? There's no other, qualifications
Yeah.
or requirements.
And we can also offer transportation if they need that to the
Right.
Concord meal sites.
Yeah.
And that, yeah, that's true. Well, another thing that's kind of maybe not as well known, but I mean, there should be, is a home choice. And that is what, where people are in a facility, maybe trying to transfer or transition back
Yes.
home. You want to give a few details
It
about
is
that?
called the Ohio Home Choice, and we do try to transition those that are in the nursing home into their home facility. And we set up the home, we get them all set. It's been a great program because we're helping them become independent, you know, in a home.
Right.
And helping them along the way and making sure that they're not in the environment that they don't need to be in necessarily.
And
I don't know,
and
Tim, if
again,
you
it's
wanna
sort of a
elaborate.
win-win where the person would rather be independent at home.
Absolutely.
And
Absolutely.
if they're on Medicaid, the state doesn't have to pay for somebody, you know, in a long-term care setting.
Absolutely.
Right, and it's designed for that person that again, is able physically to leave the nursing home, but again, may not have the means, the ability, the family support, any of those type things to do this, in essence, on their own.
Right.
Because not only do we help them make that transition from the nursing home to independent living, but we will go out and find the independent living place, we will stock it with furniture, we'll stock a pantry, you know, really set them up, and then we follow up with them on, I think, at least 3 different intervals. We follow up with them
Absolutely.
over the course of the first
caseworker
year.
as well.
Right.
The social worker follows up to make sure that they have adjusted back to that independent living cycle, they have everything they need. So again, it's not just, here's your apartment, do
Good
well.
luck.
Yeah, it's everything is stocked, we'll follow up with you, we're here to answer questions. And it's just a fantastic program that Easter Seals across the entire state of Ohio is involved in. But we're very fortunate, because we've seen significant growth of that program here in our service area.
Well, that's very good, and again, I've seen the need for something like that myself, having gone into long-term care facilities where people,
Yeah.
you know, they just didn't have that family, like you say,
Right.
to
Right.
help
Right.
them.
Right.
How about home-delivered meals? We've talked a little bit about that, but do we want to describe how that works?
Well,
Go ahead.
okay. Again, it came with the congregate meals since 1994. It's a Title III. We deliver meals at home. We've been doing it we have an actual driver that goes to the home, drops the meals. Our office contacts the clients periodically and surveys them to make sure we get their feedback continually, to make sure that they're satisfied with the meal, what they'd like to see.
Okay.
I mean, it's a wonderful program, it really is, and we probably do about 800 to 900 meals a day.
Oh, you're kidding.
That are home delivered.
I had no idea.
And we have
Wow.
Mahoning County and Columbiana County. That's the 2 counties that
Wow.
we're servicing. Not only through Title III, though, but individuals that are on passport and waiver programs are with the MyCare Ohio now, because a lot of Medicaid programs switched to the MyCare Ohio.
Okay.
They can also contact their case managers and individuals to see if they can qualify for a home-delivered meal. So we can also, while we're out there delivering the Title III meals, we can also then service other funding sources and deliver their meals too.
As you said, in total, I mean, we're doing well over 16,000 meals a month.
A month.
Between the congregate program, between the home delivered meals, and again, it's just an invaluable resource for the seniors who may not have the ability to prepare a meal themselves, or quite honestly, they may prepare a meal, but it may not have the nutritional value
Sure.
that they're going to need. Because again, same thing with the strict nutritional requirements. The meals are out there. Sometimes it's a contact vet senior, just to have
Oh,
a contact
social,
with a
yeah.
person delivering the meal, and
Especially if family lives out of town.
Right.
You know, we're
Right,
kind of
they're
like
the
that.
only person-
We're the
yeah.
pipeline, yeah.
They may
Many
see
of
that day. Yeah.
Actually, my mother-in-law gets the meals, and she loves her driver. I mean, she really does, wait to see him and talk to him, and
Sure.
that's become her
Well, it's like a
her
slow, or
friend.
the older times where we actually talk to neighbors and, you'd see people.
little bit.
Sure.
Yeah, so that brings that back a little bit. Well, have you seen an increase in the demand for that, or have the number of meals over the years kind of
Yes.
gone up?
Most definitely.
Yeah, I would say, because we have an aging area,
And-
with more need, I guess.
Absolutely. And again, it's about, providing the services that can give someone the quality of life so they can remain in their home. They don't have to look for the next step, maybe the nursing home, because they can, maybe they're not able to prepare that meal every day, but now they can have a meal every day. It's the nutritional facts are all there. There's so many, positive effects that come from it.
Sure. Well, we have a few minutes to go, and maybe we could put these all together where you have occupational therapy, physical therapy, speech therapy, and then private duty and aid services. So these are medical type
Sure.
Services, but do you want to talk a little bit about
Yeah,
that?
let's maybe break those into two pieces. Let's talk about the therapies first. The physical therapy, the occupational therapy, the speech therapy. I mean, those are all very, very needed services that we offer to seniors. Someone that had a surgery, that's recovering from a surgery. There's many options in town where someone can go get physical therapy or speech therapy or occupational therapy. I think what sets us apart, different from a lot of those providers, is first of all, the aquatics piece for
Right.
that senior is very, very big. But then more importantly, we have a very committed and passionate staff that is very well trained, that's been doing this for a long time. The seniority of the average therapist at Easter Seals is extremely long. We have people that have been with us doing this for 25, 30 years. But we also remain current on all the various treatment techniques. We can offer, again, exactly what that physician orders. There have been many cases where, the physician may have directed the client, maybe you want to go here, and the client has said, no, I want to go to Easter Seals.
Okay.
And someone was just relating a story to me the other day of, the client that came to our place for therapy, went back to their physician, who might have been a little skeptical because they may not have known that Easter Seals provides this, but when the client went back, they were very, very impressed with the progress they had made, with how they benefited from the therapy, which to me, I credit back all to the therapist, to the staff, to the social workers, to everyone that works with that client when they come in, be it, again, for physical therapy, occupational therapy, speech therapy, recovering from a stroke or something like that for a senior. The other thing about the speech therapy, obviously, is it's tied very well into the hearing.
Right.
And the audiology services also. So, again, people think of our therapy services sometimes as just therapy services for children. But actually, one of our fastest growing therapy areas right now is the adult therapies.
Sure.
And I think the pool and those things help to make that a very valuable service.
And we just have a couple minutes to go, so why don't we just talk, we have talked about transportation, but let's end it with that and maybe talk about what you have for transportation.
Well, for transportation, we're able to transport if someone wants to call our number to see if we have slots available for medical and social trips. We also do transportation for trips where we take a group to go see the Christmas lights or go shopping for Christmas. Transportation, we make available for some of our services to get to and from, like Youngstown Hearing and Speech. We have a client that needs help to go once a week there for speech therapy.
Or the Adult Day Center.
Or the Adult Day Center, yeah, absolutely. So, and our vehicles we have several types of vehicles. We have a modified minivan with the wheelchair lift.
Okay.
So it's more, they're not in a big bus, at least
Right.
it's more convenient for them. There's a lot of individuals like to travel that way.
Sure.
Or we have the larger buses with the wheelchair lifts. We have two, accessible wheelchair available in our big buses. And, that's,
So again, people would call 330-743-1168. And I want to thank the folks here from Easter Seals. Again, there's a whole range of services. So, give 743-1168 a call, give that number a call, and you can find out everything that they have for seniors. Thank you all for coming in.
Thank you for having us.
thank you.
And again, you've been watching Senior Focus. My name is Bill Adams. I'm the host of the show. We come to you a couple times each month through Channel 20 and 100 on Armstrong. Thanks to Greg Roten from Armstrong. And again, thanks to Keith Kaiser from Mill Creek Metro Parks for allowing us to use the beautiful Davis Visitor Center. Until next time, thank you for watching.